creating eye disease awareness to the rural communities by Dr. Katinture, an eye doctor from Mulago Hospital. She says that eye diseases are very common, though most patients are not aware of the right treatment.
Eye diseases are very common, although patients are not aware, and this specialty is not everywhere, because now, like ophthalmology department, you find it only in regional referrals. Like in these health centers and district hospitals, you don't find the eye services common there. So that's why the patients are many, and I think there is also a poor seeking health because patients are not aware that actually they can get the services.
Blindness is caused by a number of diseases. However, most of them can be treated, according to Dr. Betty.
Some of the diseases are like pressure of the eyes, there are also that cause blindness, like cataracts and allergies in children especially. Most of the diseases in the eyes can be treated. Okay, there is what we call actually preventable blindness. So like those cataracts we are saying, like the glaucoma, if they are diagnosed early, they can be managed. And for the cataracts, if there is an operation done, then we expect the patients to have restored vision when all goes well.
Dr. Betty talked about both long and short-sightedness and how they can be corrected.
In short-sightedness, this is when we have, it's like a refractive error. So you find that the patient is able to see things that are nearer to them better than the things that are far from them. While for long-sightedness is where the patient is able to clearly see things that are far, and yet what is near them, the objects that are near them, is difficult to see. Yeah, but we usually correct those with glasses, although we also have refractive surgeries. But what we do commonly here is we use glasses to correct them. You can just be born like that. You're born with maybe a small eyeball, and then you find you're being long-sighted, or you're born with a big eyeball naturally, and you find you're short-sighted. But there are also other causes, like when you're having like allergies, long-standing allergies, and the patient keeps rubbing their eyes, you find they're still going to get those refractive errors.
The misconception of people using urine to treat their eyes. She says that this causes more harm because urine causes more infections.
That is a misconception, and some patients have used urine and incidentally got healed. It's just by mistake that they get healed, because some patients anyway are meant to get healed, whether they use anything or nothing. Like you find they have an eye condition, maybe an infection or something, you find it is self-limiting. So when it is self-limiting, whether you've used anything or not, it is supposed to go. So when they put urine and they see that actually they have recovered, they tend to think that it is the urine that has healed them.
A routine eye checkup is recommended, and keeping the eyes clean all the time to keep the eyes functioning properly.
What I understand is we are supposed to seek health care, a routine. We are supposed to be doing a routine eye checkup, so that if there is anything, maybe we intervene early enough. Yeah, but for eye conditions to come, of course, we have to take care of our eyes well, wash hand hygiene and washing the faces well to avoid infections. Yeah, basically that. And for other diseases like cataracts, we said, so some diseases, systemic diseases like diabetes also can lead to those cataracts. So early screening of that diabetes and well controlling it can also reduce.
Story by M. Frank and Crystal Henry, UCTV News.